Shalom, this is Graciela Salinas, and we will be talking about the PCA pump today. PCA, Patient Control Analgesia. I'm not sure if you have seen it or not, but the PCA has been around for a long time. Ever since I started working here in the United States, we were already using the PCA back in the 80s. It didn't look like this, but we were using some kind of PCA pump. So let me just tell you that on this pump, on my left, which is on this side, this is a chamber, and this is where you will put a syringe. The syringe comes already with the medication, the concentration, that they supply, the manufacturer, just like if you were having a vial of medication, the syringe has the medication. And the typical three medications we use is either morphine, Demerol, or hydromorphone. And again, they come in concentrations that are already known to the PCA. So when you put the syringe in there with the correct medication, of course, it has a tubing that has to be connected to the IV. The IV has to be in place because the IV flowing is what is going to push the medication in. The doses sometimes are so minute that it needs that flowing of the IV to get into the vein. So there has to be an IV, most commonly normal saline, but it could be anything else, D5W or lactated ringers, whatever the doctor ordered. So and then you just piggyback your tubing into the IV tubing. And then, of course, before you that, you have to prime it. You have to make sure that you get the right dose, and you have to program the computer. That's the beauty of it, that you program the computer so that the patient independently will be able to press the button so that they can decide when to take medications. Now, we're going to program it to give so much dose every so often, but the patient decides if he wants to take that dose or not. They can push all they want, but the machine will only give them the medication that we program to give. So it's very important that you do the programming accurately, because if the doctor orders so much medication, but you don't program it correctly, the patient may get too much or too little medication. So have to be careful. And as you can see here, there are numbers, and there is the enter button. To me, these pumps are so easy. This one and the IV pump, they're so easy because in this screen, they will tell you step by step what to do. They will ask you the questions. What is the medication? And then you select. It's going to give you the choices right here. Is it hydromorphone? Is it morphine? Is it Demerol? So you select. And then it's going to ask you what concentration, and you select. And then it's going to tell you what is the dose, and you put the number and press enter. What is the interval? And you put the number and you enter. So you answer all the questions, and then you just press start, and that's it. So I will go over the order in a minute so that you can be familiar with how an order looks like. Remember that now everything is computerized, so what I'm going to show you may look different than whatever computer program you're going to be working when you come to the United States. So here, actually, I think I skipped one because I wanted to show you the button. Here is the button, and this is what you're going to give to the patient. It's so important that the patient can follow directions, that the patient is awake enough to press the button. And I'm saying that because if they come from surgery, they may be too sleepy that you cannot do teaching. So maybe you need to do the teaching, or the teaching has been done before the surgery. But it's the patient, the one who has to press the button. So they have to be able to follow directions. If they don't speak English or Spanish, then you may need to find an interpreter. You cannot use the family members. you have to follow the hospital policy, and most commonly you're gonna have to get somebody from outside, whether it's an AT&T operator who works on translation, maybe is somebody in the hospital that is in the language department, but you need to get somebody to help you with that education. And you will make sure they can, again, press the button. They can press the button all they want, but the machine will only give the medication that you have programmed to be given. And now I can show you this. I don't know if you can see on this side, on the right side, my right side of the pump, there is a little bump here that looks like silverish. So that's where you put a key. To open the machine, you have to have a key, because remember, you have a big syringe. The syringe is usually about 10, 20, I think it's 10 centimeters. And just imagine if a person who likes to use drugs can get a hold of that big syringe. Whew, they'll be happy. So we lock them. Then think about patients who may move what we have programmed, the programming. If they could mess that up, then they can again give themselves an overdose, too much medication or too little medication. So that's why we use a key. Usually we carry the key with us. In some areas, every nurse has a key. In some areas, there is a key attached to some unit keys, and you have to chase them down. Anyways, now let's look at what we have here. First, like I told you, you're gonna have to select, well, not you, you're not doing the order. It's usually the doctor, the one who selects that it needs to be a patient-controlled analgesia. And once they click on that, then the next menu opens, which is this one right here. When they open this menu here, then the three choices that I told you will open up. Well, in this case, there's only morphine and hydromorphone because it's opioid. For opioid naive patients, for opioid average patients, and for opioid tolerant patients. As you can see, the doses go from little to more. We also use Demerol, but in this example, they're not using it for some reason. In here, they check off hydromorphone for opioid naive frail patients. So it's a small dose. And this is without a basal or without a continuous dose. So it says that it's hydromorphone PCA 0.2 milligrams Q 12 minutes for a maximum of 1 milligram per hour. And if you take that into consideration, 12 times 5, which is 5 doses, because there are only 5 12s in an hour, that is 5 doses times 0.2 milligrams, that's 1 milligram. So every hour they can have a max of 1 milligram. Again, 0.2 milligrams every 12 minutes means that they can have 5 doses. So 5 doses multiplied by 0.2, that equals 1 milligram. So this person can have up to 1 milligram per hour. That's what is checked. So when I'm programming my computer, I will go and get my syringe, and the syringe is going to say hydromorphone PCA. And so when it asks me what is the medication, I'll say hydromorphone. What is the concentration? I will say, and probably it's 1:1, 1 milligram to 1 cc. When it asks me what is the dose, I'm gonna say 0.2 milligrams. So I will press 0.2. When it asks me what is the interval, I will say 12 minutes and enter. And what is the max per hour? And I'm gonna say 1 milligram and enter. So I have programmed my computer, my pump. Sometimes it asks you about 4-hour interval. I don't think that is the case anymore. It used to be some pumps, if they are older models, they may be asking you about a 4-hour interval. So if I'm giving 1 per hour, then that will be a 4 milligrams for 4 hours, right? So this is an example. Always, regardless of what they check, always there's going to be an order of naloxone. And this is just to reverse in case there is some overdose. The naloxone is always going to be available for the patient. On whether, again, just in case as a prevention if there is an overdose. And this is another example with basal. This example here was without basal. It was just the regular dose. This is with basal. So again, they will select that is a patient-controlled analgesia with basal. Basal is continuous. So regardless if the patient clicks on it or not, the patient will get a minimum dose. As you can see here, we have, it has been selected morphine PCA basal, 0.5 milligrams to 1 milligram every 12 minutes for a maximum of 5.5. So the basal, the continuous dose is going to be 0.5 milligrams. And then the PCA, the patient control, is going to be 1 milligram every 12 minutes. And again, 12 minutes, that means 5 doses. 5 doses times 1, that's 5 milligrams, plus the 0.5, that's equals 5.5. So you have to really be good at math. So how, if I think of that, this is morphine. So if I go to my pump, I'm gonna open it, make sure that I put my PCA medication in there, which in this case, when I set it up, it's gonna ask me if I want it as a basal, with a basal or not, if it's just PCA. So the pump can deliver PCA, meaning just with intervals every so often. It can deliver PCA and continuous, which in this case, they calling it basal. So it's gonna ask me, gonna give me the choice, and the other option is just continuous. So when the patient needs the medication, but they cannot press the button. So I will say it's morphine, PCA, and it's 1 milligram, 1 to 1. So I will say that's the concentration, and then the dose. What is the basal dose? It's gonna ask me first, and I'm gonna say 0.5 milligrams, and then it's gonna ask me what is the PCA dose, and I'm gonna say 1 milligram. What is the interval? That will be 12 minutes. What is the maximum every hour? And I will say 5.5. So that's because of this order right here. So PCA will help you a lot because you won't have to be right there medicating the patient every so often. However, you still have to document, sometimes every 15 minutes, sometimes every hour. You have to be asking the patient about what is your level of pain on a scale of 0 to 10, 0 being no pain at all, and 10 being the most excruciating pain you have ever had. What is your level right now? So every time you make an assessment, you're going to have to ask that question and document it. You're going to have to look at the history. If you can see this button right here, you can see the history, and you will be able to see how many times the patient pressed that button in the last 15 minutes or 1 hour, whatever time has elapsed. And of those, how many doses the patient was able to get. And if the patient is not pressing anything, if they're just fine, when you ask about the pain, they give you a very low number. Well, that means that the medication probably is being effective. If they're constantly pressing, if they are eager to get the next dose, if they know that the medication is only given every so often and they're just looking at the clock waiting for the next dose, that could mean that the medication is not being effective, and maybe you need to have a conversation with the physician to get that dose increase. So that's the PCA pump. I hope that this helps you. Again, you may not see a question specific about the PCA on how to program or anything, but you may see orders for PCA on the NCLEX. You may see the word PCA. And now I hope that you know and you feel comfortable. Just whenever you see a PCA, you will think, yeah, I know what they're talking about. Shalom. Have a blessed day.